Hi everyone, Dr. Michelle Mian here. What we're going to talk about right now is dental crowding. One of the most common orthodontic problems we see are crowded or displaced teeth. So I wanted to show some examples of that. We'll start down here on the bottom left. So this is the front view of teeth. And when teeth come in, they take the path of least resistance. And if there's not enough space for them to come in, sometimes they come in more towards the inside of the mouth, sometimes they come in more towards the outside of the mouth. As this one tooth right here, it's called a canine tooth, came into the mouth, there wasn't enough space for it, so it came in more towards the outside. You see it displaced a little higher and towards the outside of the mouth. Now this is an aerial view of that same patient with this one tooth sitting outside of the normal arc of the top jaw. Another common area that we will see crowding is on the lower teeth, the lower front teeth in particular. So here we have some mild to moderate crowding, and down here we have a bit more with severe crowding, with some teeth displaced more towards the inside and some teeth displaced more towards the outside. So here's that example again. I want to go over what some risks of having crowding are. So one risk is over time, the jaw gets a little bit more narrow and we could have further crowding. Now when teeth are crowded, it's much more difficult to clean them. You may notice this if you have crowded teeth and you try to floss and brush. You can't get quite into the crevices, say right here or right here, as well as you could if they were straight. Now what happens over time is we can build up plaque and calculus, which is hardened plaque, which is much harder for us to clean and the dentist has to take it off. And over time, if we have plaque on our teeth, it causes inflammation of the gums and sometimes bone loss around our teeth, and that's something that we would want to avoid. So I just wanted to show a picture of what calculus buildup on lower front teeth can look like when they're crowded. So we obviously don't want that. There are many modalities of treatment for crowding. We can use expanders, full or partial braces, and then sometimes if the crowding is severe enough, we need to remove some teeth in order to make space to get them straight and put them into a healthy position.